Hi everyone. So now that we have officially created George and his daughter Gina into the system, we've double checked their household. We've made sure that George has signed a release of information giving us permission to collect and share his information with us and the system. We have assigned ourselves case manager for both of them, and now it is time to add an entry exit. Now, the thing with our entry exit, when we click add entry exit, we want to make sure, the same as before, that everyone listed that is part of the household on the top are included here. Again, if someone is listed that is not in the household or shouldn't be here, please watch our future video later on in this training that explains how to remove someone from the household before getting to this step. The provider, you should never have to change this if you are entering data as, on the top right, the correct program, which we are. If you find yourself having to change this, please exit this, go back to enter data as, and enter data as the correct project, which we are. But you always want to make sure you are under the correct project before putting any information into any client profile. So we're going to select both. We're going to say they both came into our shelter. Now there's different types. We are going to focus on HUD as that is the one mostly used. Our HUD entry exit is the one that many federal funders use. However, we also have projects that use PATH funded or VA funded projects. We may have more in the future, but right now those are the three main funded projects that we use. Okay, so we're going to select HUD. Most of the time you're going to be selected HUD unless you are told otherwise. Now, our project start date is the date the clients entered our shelter. So they entered on the 7th, so we want to change that to the 7th. Notice I do not need to backdate because the project start date, any date that I put here is going to be active as of the date that I'm entering the clients into the system for. So we can change the time. So we want to, if our clients entered our shelter at 6 p.m., we're going to put 6 p.m. and we're going to click Save and Continue. So again, we didn't have to change anything here because we're entering data as. We have both people in the household selected. That is correct. Our project type is HUD. Our start date is the date they entered our shelter. And the time is the time they entered our shelter. And click Save and Continue. And now we have this. So on the top, you'll see provider is the Rhode Island Family Shelter and the type is HUD. If I made a mistake and I needed to change this HUD to maybe PATH or VA, then I could do that here, but nothing will change until I click Update. That is not the case. We know this is correct, so we're going to leave it as HUD. Okay, and then you'll see here household members associated with this entry exit. You want to make sure that this is correct. We have George and we have Gina. George is the head of household, Gina is not, and they both entered our project on the same date. Okay, you want to notice on the left-hand side, household members. These are all of the people that are entered into our project, into this project. So we have George and Gina. This means we have to do an entry assessment for George, and then we have to do an entry assessment for Gina. The one that is highlighted is the profile that we're on right now. As you recall, I said that all of the stuff in the client profile is pulled forward into our entry exit. Now, these are history bars. The brighter the green is, that means the more recent the information is. If you ever see a red history bar, it means it's over a year old. So the darker it gets towards red, it doesn't mean right or wrong, it's just history. And you can click on it, see who answered the question and when it was answered. You never want to change any of this information here. If anything is not accurate, you want to make sure you go back to the client profile, change that there, and then start your entry. Okay. So the first thing, you want to make sure everything from date of birth to gender is already answered, and it is. So that's good. Then it asks if a client has a disabling condition. For this, yes or no. This is all self-reported and no documentation is needed at this time. So we are going to say that George said yes, he does have a disabling condition. Now this asks again the relationship to head of household. Notice on the top, as we reviewed, head of household, we want to make sure that whoever is listed as the head of household is identified as the head of household in the entry-exit. So the relationship to head of household is going to be self, as he is the head of household. If the household tab does not match what you list in your entry-exit, then this will pull through as a data quality error. Client location, this is the COC. Rhode Island only has one COC, and our COC code, the Continuum of Care code, is Rhode Island 500. So you want to make sure that even though there's only one option, that you're always selecting this. Residence prior to project entry. This question asks, the night before this family or individual entered your project, where were they sleeping? Where did they stay the night before? So on February 7th, George came to us and he said he was staying with a friend. So when I select this, the drop-down list, you'll see different options. There's homeless situations, which is living outside or a place not meant for habitation, emergency shelter, safe haven, which there are none currently in Rhode Island, just as an FYI, interim housing, or an institutional situation, foster care, hospital, jail, long-term care facility, nursing home, psychiatric hospital, substance abuse facility, and then there's transitional and permanent destinations. So, although couch surfing to us seems as if it may be a homeless situation, according to HUD, it is not a homeless situation. To us, if George told us that they were staying with a friend, then we would want to put staying or living in a friend's room or apartment or house. Okay, so that's what we're going to select. Okay, the length of stay in previous place means how long were they staying in or living in a friend's room, apartment, or house. Now, the thing is with this is if they were there for more than 7 nights, if they were homeless before, then their homelessness period has broken. So we're going to get into that more in detail in our chronic homelessness training, but for now we're going to look at the length of stay in previous place as being if he was there for, we'll say, 2 months. We're going to put 1 month or more, but less than 90 days. Now you'll see automatically it populated, did you stay less than 7 nights? No. And the reason for this is because if he did stay less than 7 nights in a non-homeless situation, but was homeless before that period, then other questions will pop out so we can count if he was chronically homeless or not. However, just to show you an example, if I put he was there from 2 to 6 nights, this answer changes to yes. And then it asks on the night before, so on the night before they started staying at their friend's house for 2 to 6 nights, were you staying on the streets, in a shelter, or in a safe haven? So if I select yes, more questions will pop up. And it asks the approximate date homelessness started. This question has to do with the length of time since this most recent episode of homelessness has started. An episode of homelessness is any period of homelessness not separated by 7 days or more in a non-homeless situation. So, if George just came to us today and he said he was staying in a friend's room, apartment, or house for 2 nights, and he was homeless before, so we'll say he was on the streets with or in his car with his daughter for a month. So what we would do is say that his homelessness started a month ago when he started sleeping in that car. So the approximate date homelessness started, if today's date's 2/7, would be 1/7. Now this can be estimated, but you want to try to get documentation as soon as possible if it's not recorded in HMIS, as much as you can to document their previous episodes of homelessness. This will become extremely important when it's time for housing. Okay, and then this question, regardless of where they stayed last night, the number of times the client has been on the streets, in shelter, or in safe haven in the past 3 years, including today. A hint for you is that you can scroll to the top of this entry-exit, click on the top bar. And now a lot of the times your client has already been in the system. So you can just click on this and drag it down, and you can view their previous entry exits right here. So you can see in the last 3 years, how many times have they been homeless? Okay, if they're not sure, using HMIS to verify that information is very helpful. So we're going to say that this is his first time. Okay, and now the total number of months. Now this is that the person was homeless on the street, in shelter, or in a safe haven in the last 3 years. Now each day in a month is 1 month. So if George was homeless January 7th to February 7th, that is 2 months, because it's 1 January and 2 for February. If he was homeless on December 31st to February 7th, he would then be homeless for 3 months, because that is December, January, and February. Okay? So for now, we're going to say 2 months, because if he's been homeless since January 7th, and it is now February 7th that he's entering our project, we want to make sure that we record that that's 2 full months, January and February. So these are the questions that will pop up when George asks you, when a client is in a non-homeless situation for less than 7 days before entering your project. Okay, so we're going to go back to what I initially said, and I said that he was staying in a friend's room, apartment, or house for 1 month or more, but less than 90 days. And now total monthly income. So what is George's total income? If he tells us he gets $755 of SSI, then that's what we would record. There is no documentation needed at this point. Okay, so we would type in $755. Sometimes on the live site it won't let you type in more than 5 digits, so it's okay even if you just did 755 dot. Okay, income from any source, we want to make sure we answer yes. So George has income from any source, yes. If there's anything here, this should always be yes, unless this said 0. So if George had no income, this would be 0, and this would be no. Okay, so for now we're going to say he told us he had $755 of SSI. We're going to click on monthly income. Now, there's a few ways to do this. What you want to do, if this is a brand new client, is click on this HUD verification. This does not mean that anything in this is wrong. It just means things are not answered. So this HUD verification link, when you click on it, it's going to show you all different sources of income. Okay? The best thing for you to do is to review these with your client and ask, do you receive child support income? Do you work earned income? Are you getting general assistance? Any pension, SSI, SSDI, TANF, retirement, unemployment insurance, VA, disability, workers' comp, any of this? It's best to go through the list with your client. When you do find out what type of income your client has, you can either select no for every single one they do not have, or you can select no on top and then go to the source of income your client reported to you. So for me, it's SSI, and I'm going to select yes. And now this will pop up. It says monthly amount. So this needs to match what we recorded on the previous question where we put $755. Receiving income source is yes. And then if other, please specify. This is not required. This could just be helpful for you. So if he was, for example, getting SSI for his daughter but not for himself, that might be important for you to note here. This is helpful if it was another type of income or earned income and you wanted to explain how you calculated the monthly income, like how many hours a week are they working. But either way, this is the monthly amount they want to know. We don't need to put a note here because we know it's SSI. The start date is the date he reported it to us. If George told us that he started getting SSI in 2015, that does not matter. We only want this information in the system as of the date we are collecting it from him. So as of 2/7/19, he was getting SSI. There is no end date yet because he is still getting SSI. And then we click Save. And now we see that SSI has an answer to it because we can edit it, and these are all grayed out. If everything else is still no, we now click Save and Exit. Now we see here the HUD verification is now a green check. Okay, it says all monthly income records verified. This does not mean that there's no duplicates. This does not mean it's answered correctly. This just means that every type of income has an answer. And then there's a few ways you can double check the income you put in. So first, you see total monthly income $755. You can click View Gross Income, and your gross monthly income should equal $755. That's a quick way to check that you've done it correctly. Click Close, or, especially if your client's been in the system for a while, this magnifying glass next to monthly income can be clicked, and you can sort this by source of income by clicking on any of these. So you could technically sort by provider, date effective, start date, source of income, monthly amount, receiving income source, or end date. For us, it's source of income because we want to make sure there's no duplicates. Even though that we just did this, in the future, your client will have been in the system in the past, and you want to make sure that if you listed an SSI, there's not already an SSI listed in here. So we checked, and we see that there's only one SSI for $755, and it is yes as of 2/7/19. So this is correct. And we can exit. And income is completed. Next is non-cash benefit from any source. So if your client gets food stamps or WIC or any type of TANF or different TANF funded services, you want to make sure that you do indicate that here. So what we're going to do, the first thing we're going to do, we're going to exit this. It says that you have not answered it. Would you like to update these now? We're going to click no, because you want to make sure you don't skip these questions in the middle. These are easy to miss, especially when you're in a rush or being interrupted when you're case managing clients. But you want to make sure that if your client says yes, they do have a non-cash benefit source, that you select yes. And we're going to say George does. George does have food stamps. So what we're going to do, we're going to click on HUD verification again. And we're going to do the same thing we did before. We're going to do no. And then for supplemental nutrition assistance program, these are food stamps, so SNAP. We're going to select yes. Now, unlike the income, a box did not pop up. So what we need to do is, once we verify that we selected the right type of non-cash benefit that they're receiving, we'll click Save and Exit. But we're not done until we go into that benefit and we add how much of food stamps they are receiving. So we don't see it listed here. You'll notice there's numbers showing 1 through 5 of 6. So there's one more. Click Next. And now here is the food stamps that we just added. We click on the pencil for it, and we see as of 2/7 they're getting food stamps. How much of food stamps are they getting? What is the amount of their non-cash benefit? And George tells us he gets $96. Receiving benefit should be yes. Don't need to do a note here. And then there is no end date yet, because he is still receiving $96 as of the date he reported it to us. And even if he told us that he started getting it on February 1st, we are not going to change this. Okay, I'm going to save that. And then there is no view income or view non-cash benefit income button as there is for regular monthly income. But what is suggested is that you click on this magnifying glass to make sure that everything, sort by source, everything only has one answer. So there should never be 2 yeses for food stamps or 2 no's without one of them being ended. Okay, it looks like each individual answer is answered once, so this is perfect. And we click Exit, and now we know that is done. Now they want to know, is George covered by health insurance? Yes or no? So we're going to say yes, and George told us that he has Medicare. When you click on HUD verification, you're going to see all different types. So Medicaid is more as like neighborhood or any state type of health insurance in Rhode Island. Medicare is for either the elderly or disabled. There's state children's health insurance program. You want to use this for out-of-state children's health insurance programs. Most of the time in-state would be Medicaid. However, since we're in Rhode Island, if someone came with Mass Health, that's what this would be. And the same with state health insurance for adults. There's VA medical services. There's an employer-provided health insurance. There's COBRA health insurance, private pay health insurance, Indian health services, or other. Now, the Indian health services and other were added as of October 2017. So you want to make sure if this is a client that's already in the system that these questions are answered. Now, for this case, John told us that he has Medicare. So we're going to select no for everything and then select yes for Medicare. We're going to save and exit. Now, obviously, there's no monthly amount for health insurance, so what you need to do is go into the magnifying glass and just double check that he only has one answer for each type of health insurance. Okay, and he does, and that's perfect. Okay, now disabilities. Now, this could get tricky. So you remember that George told us that, yes, he did have a disabling condition, and you remember that he is getting SSI. It's maybe difficult for some clients to explain their disabilities to you. So as I did and just exited out of it, you want to click on HUD verification. And you want to go through different types of disabilities. So maybe it's alcohol abuse, both alcohol and drug abuse. Drug abuse is down here. Chronic health condition, developmental, HIV/AIDS, mental health problem, physical. So now, if a client is in recovery for either alcohol or drug abuse, they are still technically considered, it would still technically be considered a disability, yes, even though they are in recovery. Other than that, there is a list of different conditions that fit each of these disability types. It's not an exhaustive list, but it is a nice list for you to show clients that will be included in some of the training materials that you are able to print once you are completed. For now, we're going to say that George told us that he has a mental health problem. So what we are going to do is select no for everything and select yes for mental health. And then this pops up. So this is extremely important, especially when it comes to chronic homelessness. There is no documentation needed at this point, but if you can get documentation, that is excellent, and you should. So it asks what type of disability and mental health. So we selected yes. As of 2/7, he reported to have a mental health problem. This question right here must be answered in order to be considered if they are chronic or not. So if yes, so if they are disabled, is it expected to be long continued in indefinite duration and impairs their ability to live independently? So this must be answered yes in order for a client to be considered chronic. If this is something such as anxiety or depression that they don't believe is going to impact their ability to live independently, or if they're not getting SSI, then it may be no. But for this case, because he is getting SSI, which means it's documented disability, and it's probably going to impair his ability to live independently. Again, this is all self-reported, so please ask your clients, but we are going to select yes. And now this is a retired question, but it means the same thing as this. It asks if the above condition is going to be long-term. Yes. And now this is going to be very helpful for you, this note on disability. It is not required, and it will not make you put anything here, but it will only make things much more streamlined and easier in the long run if you answer this. So if I put George Smith reported having mental health issues, receives SSI, reported having a mental health disability, and is receiving SSI. Case manager, SC, me, is in process of obtaining documentation that client does not currently have. And then I like to put my initials at the end of notes. It's just a helpful way for you to remember if you put the note or not, because there will be no history bar here. Okay, and there is no end date, okay, because he is reporting that he still has this mental health disability. We click save, and unless he reports a different disability, we are all set because everything else says no. So we're going to click save and exit. Okay, and your disability section is done. You just want to make sure there's one answer for each, either by clicking on the magnifying glass, sorting it, what you see, 1 yes, mental health, or by just going through this and making sure, 1 yes, mental health. Okay, domestic violence victim or survivor. Please ask your client this even if there's an old answer there. So, for example, if George says yes, we want to ask how long ago this experience occurred. These two questions are required if you put yes. How long ago, and if they're currently fleeing. Okay? If no, that they are not a domestic violence victim or survivor, you leave these alone. Okay? If you are an outreach provider, you want to add a date of contact. You would do that by clicking add, selecting today's date. It asks if they're staying on the street, shelter, or safe haven. You'd select yes, no, or you were not sure. And then the start date is the same as the end date. Okay, so this is usually what it would look like. However, we are not an outreach provider, so we do not need to worry about this. We're going to cancel that. Date of engagement is extremely important for outreach providers because this is the date that shows that the client is engaged and has begun working with this case manager towards housing. And then all of this universal data elements that we've collected is required to be collected before this date. So the date of engagement is only required to be used by PATH or outreach providers that are required to collect universal data elements but are not required to get all of the universal data elements until they show that they've engaged their client. Everyone else should always get their universal data elements but does not need to worry about the date of engagement. The housing movement date is important because this shows that a client is in housing. So if you are working with a client and they have just entered your shelter and there was a date here from 2015 to show that they're moving into housing, this client will not appear homeless in any reports, including prioritization reports, because this will make it appear as if they are in housing. Same thing if you're a housing provider. If this is an old housing move-in date, you want to make sure that this date is not here if it is not accurate. And you would clear either one, that date of engagement or housing movement date, if it's not accurate, just by clicking this blue button. Okay, and because our client's in shelter, we know they're not in housing. The housing movement date should always come after the start date, either at the same day of the project start date or after, but never before project start date. Okay, so we save this. And I have already pretty much answered Gina's information just to make things easier. So for children, it's a lot easier. All of this stuff pulled through from the client profile. All you really need to ask about children is if they have disabilities, any type of income that's not going to the parents, and if they have health insurance. Other than that, most of the answers are going to be the same, unless you're aware of maybe the child slept somewhere else and not with their parents before they entered shelter. So, if George told us the client did not have a disabling condition, we'd put no. She is the head of household's child. The client location is Rhode Island 500. She has the same residence prior to entry as her father, and you can double check by just going back and forth, going to her father's entry, making sure that says the same thing, going here, making sure you answered it correctly. And Gina has no income. And so we did that by just selecting the HUD verification, selecting no for everything. Gina has no non-cash benefits, and I did the exact same thing for that. Gina is covered by health insurance, so it's Medicaid. So I selected yes, and I made sure that I only selected yes for that. And exit. Gina did not have any reported disabilities from her father, and she was not a DV survivor. Again, because this is not an outreach provider, we do not need to add a date of contact or engagement date, and there is no housing movement date, so this is correct. Okay, so that is how you enter a client into a HUD entry in HMIS.